draw like this, and I'll draw like this. This is not bad. It looks like a heart. Yes or no?
Yes.
Yes. Now, this is not the reason I wanted to draw the heart. I wanted to tell you what is this, what is. Tell me what is this one now. That's the question. Huh? Why I put it in red then? Nothing is coming to your head. Okay. Now, look at my drawing now. What is that? Aorta. Aorta goes right side. But the twisting is there, I'll talk about that story later in the class, not today. And this is pulmonary trunk or pulmonary vein side. So, very important this diagram. Is that okay?
Yes.
This is important because this is the pulmonary trunk. It's coming from the right ventricle. Is it right ventricle?
Yes.
So direction is there. That's what you will be learning later, that you put a stethoscope, you put for the pulmonary valve on the left side. Aortic sound comes over here. And it has a very beautiful concept because actually the mitral valve is here. Sorry, the aortic valve. Because this is the left ventricle, the aortic valve is here. But the sound it is producing maximum over here. That's why I put the stethoscope over here. Because where is the bending, the turbulence is maximum. You may do like this, but maybe sound is more over there. There are places where you do a little bit over here, sound is more over there. Where the turbulence is there. So you do a little bit, doop. That is the aortic sound. But you will get maximum over it. That's why people put the stethoscope on the second intercostal space on the right side. The pulmonary by the drawing. So this drawing is $1 million drawing. Who wants to buy this? It tell you, 1,000 word. Pulmonary artery is the turbulence will be over here, where it is the bending is happening. If you still don't believe it, believe this one. Look at this. Pulmonary trunk is going towards the left. Aorta is coming the right. So where is the connection? This is the connection. And I put it in the red color so that it's ductus arteriosus. So it is not that big, which I made it like this way. That's what I said, that this is more. But now it's clear to you. And you people are not coming to the lab at all, in the evening lab. And you will get, some kind of problem, I tell you, because in the lab, you should go and see the ductus arteriosus or ligamentum arteriosus now, because it's already adult. Cadaver, I'm talking. You should put your hand over there. So there are many reasons for that. We target that because there's a nerve there, recurrent laryngeal nerve. You have to identify that. So all these things. So where is it is right over here. It's not shown over here, but it is right in the direction where the ductus arteriosus or ligamentum arteriosus should be present. And we have plenty of those in the cadaver. But if you say, oh, my diagram is okay in the book, I can understand it. You can understand this book, but you have to see it. You have to see it. Is that okay? Okay, good. Okay, now let's understand the same diagram I made it earlier. This is also very important, and I'm doing it many, many times. For a reason that the students should appreciate, not by memorizing it, There are 4 areas, 1, 2, 3, 4. It should be in your fingertips by now. Right? So all the venous circulation is coming through over here. This is called the sinus venosus. And the sinus venosus has 2 parts, one in the right side, and here is the superior vena cava. But this part and this part, the sinus venosus, goes inside the atria. This is the atria. Right? This is the atria. This is the ventricle. This is the bulbus cordis. And this is the truncus arteriosus, which has the 2 parts, pulmonary artery and the aorta. So the blood is coming over here and pumped out over there, very origin. Then it will bend. It will bend over here. So it was over here, it goes, bending over here. And then, because the right side is, is swelling a little bit bulbous, so the apex goes towards the left side. The other way around, if the left side is swelling, then it will be the right side, it will be the apex of the right side, and that will form the left ventricle. Although we call left, we cannot say right ventricle at that time because the aorta and everything also will change. Person is normal, just the mirror image. Just you are looking at it, but put it in the mirror, it will be just opposite. It's a heart. Is it doing the same thing? Person is absolutely okay, and you may not find any difficulty or anything with the patient. But that's called dextrocardia. And it needs understanding of the embryology. So let's refresh our memory over here. When I say atrium, now by default, you should understand that it has 2 parts. The smooth part and the rough part. Smooth part is coming from here, it is below, it is the lower part. And the rough part is coming on the top. So this is the atrium. Remember this atrium I'm showing you. This is the atrium on the back side. So it has gone, bending over there. So if it is like this, then when my finger is there, that's the smooth part. And it is, on the top is the crista terminalis. Can you see the crista? Can you see the crista terminalis? That demarcates the smooth part and the rough part. Now, you read it in the book, or somebody might have told you in the class, there is a smooth part, rough part, and you are trying to memorize it. That doesn't work. You should ask yourself, what is the smooth part meaning? Smooth part meaning sinus venosus. Now, what is the sinus venosus? Originally, it was receiving the blood. Then what happens to the sinus venosus? The lower part, because the liver is coming, so what happens is the liver will be over here. And those veins are now over here. 1, this is the 2, 3, 4. It's the same thing, but because the liver, it is now attached to the liver. So the vitelline vein, which is the portal vein, is attached to the liver. The umbilical vein, which is this one, supposed to be with the liver, but what happens is that it bypasses. So it bypasses and goes over here. This bypass is the ductus venosus, and it is always in the inferior surface. It is not inside the liver. It is outside. Have you seen the ductus venosus? Inferior surface. It is outside. Why outside? Because it is bypassing it. It is not the liver. I cannot draw more than this, but it is outside. It is in the inside. So these are the important concepts. Finally, are you okay with that, what I'm saying, or it is a new thing? I'm not talking anything new. You know it already. Just push yourself to make sure that you understand everything. So, right horn and the sinus venosus are part of the atrium. Coronary sinus stays outside. It is not inside. If you want to see coronary sinus, there's a big coronary sinus. Look at this coronary sinus. That's the coronary sinus. is outside. But this is the left horn, this one. And very interesting, isn't it? Because sometime I told you that if there is a double superior vena cava, then it will be attached to the coronary sinus. We ask in the exam, if there is a left superior vena cava, where it will be draining to? It will be draining to coronary sinus by virtue of the embryology, understanding embryology. Okay, good. Now, the last part, the two parts I will say. Make sure the right atrium is clear. The left atrium, basically, it is the expansion of these expansion of the four pulmonary vein. It has a little bit of the original atria a little bit, but when it is dividing, it is very small, then it will be increased by size by the expansion of this one. So it is smooth too. Mostly it is smooth. A little bit of muscle is there. A little bit muscle. Muscle means it is coming from the endocardial tube. It is a muscle. It is a smooth muscle. And how the muscle looks like, final thing I'm talking about. If I cut this as a cross section, how the muscle looks like, you will understand what's happening. That's the muscle. You got it? Yes. That's the muscle, striated muscle. Now if I do a little bit this way, then what happens is the inside one is making like this to form the septum, or maybe the valves. And that's the reason the valves on the septum are coming from this area, which is called endocardial cushion. Endocardial cushion. Endocardial cushion is inside the tube. Yeah, almost done. 1 minute. You got it? Endocardial cushion is inside the tube. The tube folds to form the septum primum, septum secundum, the ventricular septum, all this coming from the endocardial cushion. Make sense? And the valve. So you know now everything, the origin of the heart. Each part you know it, except I did not talk to you about the papillary muscle. Papillary muscle, they are basically the muscle like the musculopectinate and all, but some part it has more apoptosis, so it comes out. If you see the musculopectinate and all, you see it is hanging. You know, these are hanging, but it is coming from the muscle. So more apoptosis and this. So it is coming from the muscle. So now, and not much importance, like, don't pay much time with that. The origin of the, so let's one more time recapitulate. Atrium, right atrium, you have 100%, okay. Left atrium, you know that it's basically the expansion of the pulmonary vein. Ventricle, right ventricle, mostly coming from the bulbus cordis, and also a little bit of muscle, and then left ventricle is coming purely from the endocardial tube, right? I did not talk about these two, origin of this and how it is. It is a different story, and in the class I will explain to you. I took this purposely, this lab, to make sure the students have 100% knowledge that what is happening in the embryonic life circulation, what are the changes happening, and each part of the heart that you are familiar with. Thank you very much.